Antidepressant medications carry a variety of risks that are often overlooked by many healthcare providers. Today, I'll review the most significant, yet frequently ignored dangers associated with these drugs. Antidepressants can affect heart rhythm by prolonging the Q2 interval, which increases the risk of dangerous arrhythmias. In 2011, the FDA issued a warning about exceeding 40 mg of escitalopram in patients over 60. However, this risk applies to many other SSRIs as well. People with pre-existing heart conditions are especially vulnerable. It may sound shocking, but SSRIs can increase suicidal thoughts and behaviors, particularly in young people or where the dose are adjusted. The FDA analysis from 2005 showed that people under 25 are at higher risk of suicide-related behaviors on antidepressants compared to placebo. This risk is rarely discussed, and users may feel worse initially, which can lead to tragic outcome if not properly monitored. One of the most alarming side effects is PSSD, a form of sexual dysfunction that can persist even after stopping SSRIs. Unlike temporary sexual side effects, PSSD can last indefinitely, causing numbness, erectile dysfunction, difficulty achieving orgasm, and emotional numbness. Some people experience those issues while still on the medication, while others notice a sudden drop in sexual function after discontinuation. Currently, there is no effective treatment for PSSD, and the issue remains largely ignored by the regulators like FDA, despite significant research. SSRIs are meant to clear mental fog, but for some, they do the opposite. Users often report trouble concentrating, forgetting words, and mental fatigue. A 2016 study found cognitive decline after just 8 weeks on SSRIs. And long-term use, especially at higher doses, has been linked to faster cognitive decline. SSRIs don't just reduce sadness, they can flatten our emotions, leaving users feeling disconnected or numb. Many people describe overall lack of joy, love, and empathy. A 2018 study found that 71% of SSRI users experience emotional blunting. This emotional dullness can impact work, relationships, and daily life, yet doctors often mistake it for a symptom of the original condition, not a side effect of the medication. SSRIs can cause a gain weight due to their effects of the metabolic and appetite regulation. Over time, this can lead to abnormal obesity, elevated triglycerides, insulin resistance, and even 2-type diabetes. A 2013 meta-analysis confirmed that antidepressants users have a significantly higher risk of developing diabetes, even when accounting for other risk factors. Discontinuing antidepressants is one of psychiatry's most neglected challenges. Many people experience withdrawal symptoms, and half of them describe those symptoms as severe. These include brain zaps, anxiety, insomnia, mood swings, and flu-like symptoms. Sometimes these withdrawal effects persist and are often mistaken for a relapse, causing unnecessary resumption of the medication. In some cases, withdrawal symptoms never fully resolve, leading to protracted withdrawal syndrome, which can resemble brain injury, but doctors often fail to recognize it and treat it appropriately. SSRIs interfere with platelet function, increasing the risk of gastroenterological bleeding. This risk is often underestimated, particularly when combined with common painkillers like ibuprofen. Meta-analyses have shown that SSRIs double the risk of the GI bleeding, which can be life-threatening, but patients are typically not warned about this risk. SSRIs can trigger manic symptoms in individuals who have never had them before, leading to a misdiagnosis of bipolar disorder. This often results in unnecessary treatment with mood stabilizers or antipsychotics. These symptoms are often a side effect of the medication, not a sign of bipolar disorder. So doctors should be cautious before making such a diagnosis. The harsh truth is that for many, antidepressants provide little to no meaningful long-term improvements. A large meta-analysis showed that SSRIs only reduce depression score by 2 points on 50-point scale, clinically insignificant for many people. For some, the benefits fades or condition worsen over time. Why are these risks hidden? Because the system protects itself, not the patients. Pharmaceutical companies, fund research, influence medical journals, universities, and professional organizations. Overburdened doctors often prescribe medications for convenience, and few dare speak out for fear of being labeled anti-psychiatry. When concerns are named, the system accuses crises of stigmatizing mental illness, even though they only seek information concerned. The real risks are masked by polished marketing, leaving patients to make life-altering decisions without understanding the full picture. If you found this information helpful, please like and subscribe so that others can learn more about these hidden truths.